Heart attack, causes and current ratio. A heart attack, also known as myocardial infarction, occurs when there is a blockage in the arteries supplying blood to the heart. This blockage typically results from the accumulation of fat, cholesterol, and other substances in the arteries, a condition known as atherosclerosis. Causes of heart attack. 1. Atherosclerosis. The narrowing of arteries due to the buildup of fat and cholesterol affects blood flow. 2. Blood clots. Sometimes plaque in the arteries ruptures, leading to the formation of clots that can completely block blood flow. 3. Unhealthy lifestyle. Smoking, an unbalanced diet, lack of physical activity, and obesity increase the risk of a heart attack. 4. Diabetes and high blood pressure. Both conditions significantly raise the risk of heart diseases. 5. Emotional stress. Intense anger, grief, or stress can trigger heart problems. Current ratio of heart attacks. Heart disease cases are rising in Pakistan. However, specific recent statistics about the heart attack ratio are not available. According to the World Health Organization, WHO, cardiovascular diseases remain one of the leading causes of death worldwide. Preventive measures. Healthy diet. Opt for a balanced, low-fat diet. Regular exercise. Engage in at least 30 minutes of physical activity daily. Avoid smoking. Stay away from cigarettes and other tobacco products. Control blood pressure and sugar levels. Maintain normal levels of both. Manage stress. Reduce mental stress by ensuring proper rest and engaging in recreational activities. If you experience chest pain, difficulty breathing, or other concerning symptoms, seek medical assistance immediately.